Bismillahirrahmanirrahim. Assalamu alaikum warahmatullah. We are discussing MRI of the knee. This is a 13 years old male patient who had history of old trauma. Here we can see there is significant anterior tibial translation because of total chronic ACL transaction. Mild interstitial injury of mid and lower substance of PCL is seen, while there is significant buckling of upper and mid portion of the PCL. We can see this is upper portion of the PCL on axial images, and we can trace this is mid portion, and mild interstitial injury can be seen in it. Accordingly, we can trace it down to its level of attachment, and increased signals are also appreciated in it, suggesting partial PCL injury as well. So in this case, we have seen both ACL and PCL injuries with anterior tibial translation. Second thing is that there is depressed fracture of posterior portion of lateral tibial plateau. We can compare this with medial tibial plateau, and there is depressed portion of posterior end of the lateral tibial plateau. This is the area of the fracture. We can also see that there is blunting of inner edge of anterior horn of the medial meniscus, and here we can see soft tissue edema in popliteal fossa, especially along posterior aspect of lateral tibial plateau, and here we can see small amount of joint effusion in suprapatellar bursa. So we have seen cruciate injuries. We have seen position of the patella which is high as compared to its normal position. Similarly, we have seen blunting of inner edge of anterior horn of the medial meniscus. We have seen joint effusion and depressed fracture involving posterior portion of the lateral tibial plateau on all these images. This is the area where we can see soft tissue edema, and here this focus represents depressed posterior portion of the lateral tibial plateau. Thank you very much. Assalamu alaikum warahmatullah.